Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. And as we continue our antibiotic series, you'll continue to see a little versatility in how I am working through from a knowledge base to an application base of these antibiotics. Okay. And I hope y'all are finding it helpful. Just let me know in the comments. Let me know if you need more help with certain things with this, because I'm happy to do so. Okay. All right. Question number one. A 33-year-old female presents to the office today with complaints of a cough with a brownish colored sputum. She states she was feeling fine, but on her ride home from work, she began experiencing this cough. Upon examination, the patient is febrile and chest x-ray results show white infiltrates. The patient denies any past medical history. Based on these findings, how should the nurse practitioner treat? Is it A, Bactrim, B, doxycycline, C, ciprofloxacin, or D, amoxicillin? Take a moment and tell me what you got in the comments, you guys. All right, you guys, I always recommend reading the stem of the question first, as it allows you to slow down to ensure that you are answering what is even being asked of you. Sometimes, especially like scenarios like this, things can be lengthy with a lot of details, and can begin to go down a path and create your own scenario, your own thought process of what they're asking you, and that's not even what they're looking for when you get to the end. Sometimes it can direct you and cause you to miss the correct answer just simply because you took the bait of the direction of things, what they know that we can commonly do, and make those careless errors when going fast and not paying attention to the key points that they're asking you. So I always say reading the stem of the question first allows you to hone in on what is really being asked and then go through the fluffy scenario and decide what you need from it, okay? So this stem states, based on these findings, how should the nurse practitioner treat? Y'all know I always tell you, if it's asking for a treatment, look to see if they have provided you with a diagnosis. In the event that they have not, you need to take it a step further and look at the assessment findings so you can begin to determine a diagnosis so that you can then think of how to treat that, okay? So here, the diagnosis has not been provided. So now we need to determine a diagnosis, right? So this is where I say pay attention to your assessment findings, those things that how they present, the signs and symptoms, and any diagnostic exams, etc. Right? So this patient is a 33-year-old female. They come to the office. She says that she has a cough. It's brownish, with brownish colored sputum. So she has a productive cough. She said she was feeling fine, but on her ride home from work, she began experiencing this cough. So this has come on suddenly. The chest x-ray shows white patchy infiltrates. So, we're thinking, all right, gold standard check for community acquired pneumonia, or we could just say pneumonia. And then you would determine community acquired also because of this brownish color sputum and these sudden symptoms. I always say with my Brittany's Brilliance, that classic presentation of the sudden symptoms and that productive cough that can be brownish color, rust colored sputum is classic for community acquired pneumonia. And I said, just think about it as CAP, community acquired pneumonia. I threw on my cap because I suddenly needed to run out of the house. So we needed to run out suddenly. I just threw a cap on my head, right? And so when someone tells you stuff like, I was feeling fine all day on the ride home, I suddenly began to experience this cough. This is sudden symptoms, whereas atypical pneumonia has gradual symptoms, right? This patient is also febrile. They deny any past medical history. So, how do we treat community acquired pneumonia first line? So, the best answer here, based off of these choices, is D, amoxicillin. Now, I did this for a reason because I want y'all to see it in two ways. In this scenario, this person does not have any medical history. They're young, healthy. This is something sudden. So we just need to go ahead and treat with monotherapy, meaning one antibiotic option, right, for the management of this. So guidelines state you can give high dose amoxicillin or you can give azithromycin as those first choices. And I did it in this scenario because I want you to see it this way, because on boards, if asked in this fashion, I need you to know that you can either go with amoxicillin or azithromycin. They will not give you both answer choices in these type of scenarios, okay? So just making sure that you're aware that we can go with that macrolide or we can go with that high dose amoxicillin. All right, question number 2. A 67-year-old male patient has been diagnosed with community-acquired pneumonia. He has a history of seasonal allergies and diabetes. What is the best treatment option at this time? Is it A, Augmentin plus doxycycline, B, Bactrim, C, clindamycin, or D, amoxicillin plus azithromycin? Take a moment to tell me what you got in the comments, you guys. All right, so here the stem of the question states, what is the best treatment option at this time? So same thing, if they're asking you for a treatment, take a moment, look to see if they have provided you with a diagnosis. Here they have. So, we're already a step ahead, right? So they told us that this patient has been diagnosed with community-acquired pneumonia. This is a 67-year-old male, and he has a history of seasonal allergies and diabetes. So how will we treat this patient? So D is your best answer, amoxicillin plus azithromycin, because this patient warrants dual therapy. Now, this is key of these pneumonia style questions. With community acquired pneumonia, if you follow the algorithm for treatment, you need to determine if they need monotherapy, like the last question. So healthy, they're young. There's no although pneumonia is something that can be fatal and is a severe diagnosis, someone who is healthy and young, we're not, I shouldn't say as concerned, but they don't have as many risk factors. So you can treat them with monotherapy and, follow up, etc. Right? So that's what we did on question 1. But here, this is a 67-year-old patient. They have comorbidities, diabetes, seasonal allergies affecting the respiratory system, potentially. So with this population, you want to go ahead and treat with dual therapy, because with the dual therapy, it's given additional coverage so that we make sure that we're securing this patient because they have more risk factors, okay? So you want to make sure that you're paying attention to their age, their medical history, etc., so that you can treat accordingly. So monotherapy, dual therapy. And then lastly, question number 3, a patient returns to the office with complaints of a fever, chest discomfort, and a cough with brownish sputum. She was treated for community-acquired pneumonia 3 weeks ago. The nurse practitioner is planning further management. What would be the best treatment option at this time? Is it A, amoxicillin, B, doxycycline, C, levofloxacin, or D, azithromycin? Take a moment and tell me what you got in the comments, you guys. All right, so stem of the question first, right? So stem of the question here states the nurse practitioner is planning further management. What would be the best treatment option at this time? So again, we're looking for the treatment. Let's see if they have provided us with a diagnosis. So it has and has not, right? So they let us know that this patient has been treated for a community-acquired pneumonia 3 weeks ago. So in the event that questions give you that type of detail, you're holding that in your mind to see and rule out if they potentially have this again, or whatever, what have you, right? Or if this has led to something else, right? So then we go back a step further and look at those assessment findings. This patient returns to the office. They have complaints of a fever. They have chest discomfort and a cough with brownish sputum. All right. Classic presentation of community acquired pneumonia. We just treated you for this 3 weeks ago. All right. So now we need to figure out how we want to manage this further at this point. So, next protocol, let's think about how we walk through the algorithm of pneumonia, right? When you get to the point of either this person has been on antibiotic in the last 30 days, also we look at the last 90 days in that time frame. We also looked at failed treatment attempts, I should say. So, like this scenario, they've been treated 3 weeks ago. They're having the same symptoms, so clearly it wasn't success. It was not successful. As well as they've had antibiotics in the last 30 days. You can also ask if they've been hospitalized in the last 30 days. Also, if there's any resistant DRSP, um, the elderly population with comorbidities. All of these things build this puzzle of things that make them at a higher risk, right? So with all of these things, you're going to want to go to the big guns, right? So big guns being your respiratory fluoroquinolones, right? We've done our monotherapy. We've saw scenarios where we do dual therapy. But when it's to this point for you've had an antibiotic in the last 30 days, we look to see, 90 days, hospitalized the last 30, but it's more severe if it's been in the last 30 days that they've been on an antibiotic because we're considering potential for resistance, right? Also, it shows a failed attempt of the management of community acquired pneumonia. So, again, these are check boxes of why you would go to a respiratory fluoroquinolone directly, right? And remembering that fluoroquinolones end in fluoxetine. And our respiratory fluoroquinolones, remember Brittany's brilliance, we want to get my lungs because this is a respiratory problem. We're trying to get my lungs together, right? So, G for gemafloxacin, M for moxifloxacin, L for lungs, L for levofloxacin, okay? So C is your best answer. All right, you guys. I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And again, if you're needing additional assistance and have questions that you would like me to cover, feel free to put it in the comments. Let me know if this is helping you guys, and we'll continue with our antibiotic series. Also, if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email at the nursing studio, the number one at gmail.com. The things that I do offer are my review book, which is in the ebook or paperback option. They're both linked in the bio of this channel, so you can determine which one suits your learning needs better. If you're someone who prepares for boards or prefers to study independently, a little bit more, my online self-paced review is also available for family and adult Gero reviewers. That's also linked in the bio of this channel. If you're looking to do practice questions, if you like working through questions and hearing my rationales like this, I do have different tier QBank options in the bio of this channel as well. The mini practice quizzes are 10 short quizzes that allows you to do just what I'm saying, practice. So you can do the 10 and then listen to the rationales of me explaining it like this so that you can study. Because I always recommend as you're doing it, if you're getting these incorrect, write those rationales down and review those nightly. So with those practice ones, that's my goal and hopes for you guys is that you're able to study along, test your knowledge, and then if you're struggling or if you miss any, then you can hear me explain it. You can write it down and you can continue to study. And then the other two are the actual exams, so you can then test your knowledge that way. Okay, so those are linked in the bio of this channel. And then lastly, my one-on-one sessions. I always say reach out to the nursing studio as I like to speak with you guys to gauge what you truly need, because my one-on-one sessions are customized, but the options that you do have are you can book sessions for 1 to 2 weaknesses at a time. You can book an exam readiness assessment. You can book a question analysis session, and you can book the custom package where, depending on the time frame that you would like to review, I provide you with an initial pretest to gauge where you currently are, and during that time frame, we work alongside together. I work alongside you during the duration of time that you have stated that you want to work and study. I structure a plan based off of where I see your strengths and weaknesses are from the pretest, and if you have had previous test scores, I also incorporate those, and then we work together to take you to a successful board attempt. Okay, so if you need any of those resources, feel free to reach out to the nursing studio. But again, y'all know what to do. Make sure y'all meet me back here. Happy studying. Bye, y'all.